Before we start the session, I would like to thank Dr. Vinay Agarwal and all the organizing members of the conference for giving us an opportunity to chair this session. We all know sex is the most primitive human instinct next to survival. Despite that, there are a lot of stigmas, taboos, a sense of guilt, a sense of shame attached to the subject of sex. And it is very natural. Why it happens is basically because of the myths. The myths around sex are so rampant. We say the myths rampant are so much that only sexual myths are more than only the religious myths are more than the sexual myths. So to dispel one of these myths, which is very important, is how long the sex lasts or should last. So whether the sex should last as long as the family is not complete, or it should be 40 years, 50 years, 90 years. To dispel that myth, we have a very eloquent speaker with us, Dr. Deepak Jumani. He's come from Bombay, an old friend, and I have heard him a number of times during the last 14, 15 years. We always say when he speaks, it's something like Sachin Tendulkar. वो जब मैदान में उतरते थे तो सचिन नहीं बोलते थे, उनका बल्ला बोलता था. इसी तरीके से डॉक्टर जुमानी जब बोलते हैं तो बिलीव मी, वक्त जो है वो वाकई थम जाता है, सुइयाँ जो हैं वो रुक जाती हैं. तो डॉक्टर जुमानी, I don't know whether we have his formal introduction with us or not. So, Dr. Jumani would need no introduction. जैसे बल्ला बोलता है वैसे डॉक्टर जुमानी बोलेंगे.
Thank you very much, sir, for that sexy introduction. अच्छा पल जरूर आता है, men do get erections, पर कमबख्त वक्त पे नहीं आता. सोचा उस पल के लिए वो पल भी आया तो कुछ पल के लिए. सोचा उन पल को रोक लूं और पल के लिए, पर वो पल न रुका एक और पल के लिए. This is the state of affairs of most of the people who have diabetes, hypertension, dyslipidemia, obese, smokers, alcoholics, watching porn, etc. Around the world, people love. They sing for love, they dance for love, they write poems, there are legions, there are ballets, there are movies. Some kill for love, some build for love, some die for love. In fact, we all sitting here are all victims of love. We are all born out of love and sex, but we don't talk about it. The first important lesson which I would like to give you is, please ask your patients about their sex life in your short history, whatever you take. Ask them one simple thing: do you have problems in making love? It's a very simple thing, not a vulgar thing at all. You will be surprised that your patients were waiting for you to initiate a dialogue on this aspect. They are embarrassed, they don't want to talk about it, they feel you will become judgmental about it. 82% men who have erectile dysfunction live in silence. Men having erectile dysfunction have earlier death. Erectile dysfunction is the earliest marker of myocardial ischemia. There have been 30,000 cases in the courts of India on impotence. We all are evolved physicians. In this era, we all know that whatever is less in our body, we can increase it, be it hemoglobin, calcium, vitamin D, B12, and whatever is more in our body, be it sugars, salts, oil, etc., we can reduce it. So there is nothing that we cannot change. In this world, There are 5 cities where men and women are staying for more than 120 years, physically and sexually active. Dan Buettner, the scientist of natural geography, went to see these people in those cities, and he found out the reasons why they stay there. And we have those reasons with her, and we can implement those in our lives. In this next 30 minutes, I'm going to give you some nuggets of wisdom as to how you can increase the understanding on this aspect of your life, which is a part of the quality of life, but one of the best qualities of life. With pranams to God and thanks to my teachers, Dr. O.P. Kapoor, Dr. Prakash Kothari, and Dr. Shashank Joshi, I beseech them to bless me always. Mitro, look at our Prime Minister, his hands are down. He offered us lockdown and GST. He couldn't help, he had to. Then he told me, Deepak. So I said, look, my hands are up. I said, I shall also offer unlockdown and GST, and my GST to all of you is great sex therapy. At the beginning of marriage, every wife treats her husband as God, Pati Parameshwar. But sooner or later, somehow I don't know why the words change. What urges make men chase women they have no intentions of marrying? Can anyone tell me? Dr. Ajay?
You have asked a pointed question to the chairperson. Ask the audience.
So it's the same urge that makes dogs chase vehicles they have no intentions of driving. At 30 to 39, the throbbing times, sometimes khushi, sometimes gum. At 40, he is scared, kal ho na ho. So he becomes naughty. At 50, he's got diabetes, Pappu can't dance ala, ho gaya. But then he comes to Dr. Jumani, he treats him, and then he says, Buddha hoga tera baap. So, 40 is the old age of youth, 50 is the youth of old age. Duke longitudinal study says that frequencies of intercourse is a significant predictor of longevity. Early cessation of sex is associated with premature death. 50% reduction in cardiac death was seen when they had more orgasms or 2 orgasms per week. The Australian longitudinal study, which studied 8,000 participants above the age of 50 and also 635 participants above 60 to 64 years, they all said sex was very pleasurable. Amongst them, 56% were women and 81% were men. A new study wherein 70-year-old people were studied on health and sexual relationships. 4 cohorts, at 4 periods they were studied, and all of them said they were more satisfied with sex life, they had less sexual dysfunctions and more positive attitudes towards sexuality. Sexuality is a fundamental right. Doesn't stop at 50, 60, 70. It's all we stop it. Abhi kya karne ka? Nahi hota hai. Chodo, all that. There is no age for sex. Trust me, friends, from 9 years to 90 years a man can have sex or a woman can have sex. And there is no time. It could be morning, afternoon, night, whatever time. And sex really has no expiry date. At the end of my talk, I'll prove it to you. Sex is the best prescription of longevity. This has been said by American Urologist Association and American Heart Association because it improves every system of our body. And it is said, use it or lose it. Rishi Vatsayana in Kama Sutra clearly says sex is to be used, not abused. There is no study or no report of any man or a woman dying while doing sex. up till now. People who had post-coital death, men, they died because they had sex with an illegitimate partner after heavy drinking or heavy meals. Sexual activity triggering myocardial infarction, you shouldn't worry about it. Studies have been proven that. And all unmet sexual desires lead to psychosomatic symptoms. It has been proved. All those who are sexually deprived or they didn't have sex, they all have psychological problems. Impotence has been the main cause of divorces in India. Every male or female today has some or the other bedroom woes. 40% of men above the 40 have sexual problems. 62% women admitted that they are not satisfied with their sex life, perhaps because of their husbands or better halves. Intimacy, friends, is ageless. But to ignite intimacy, you need to have strategies of intimacy for a complete mind, body, for optimal pleasures. Masters and Johnson's beautifully described a male sexual response which begins with the desire, leads to erections, ejaculation, and resolutions. In females, it is desire, lubrication, and they have multiple orgasms, and then there is a resolutions. When we look at the disorders in male and female, males' desires are low desire, erectile disorder, ejaculatory issues, painful issues. In women, there are female interest, arousal desires, arousal disorders, orgasmic disorders, and genitopelvic pain penetration disorders, which includes vaginismus. Let me give you a new perspective. Today in India, sexuality is one of the prime reasons. Women are getting married late. They're getting married at 35, 36. And in our times, it was, we got our daughters married in house where the boy was well-to-do. Achhe khate pite ghar ka hai, meri beti sukhi rahegi. That's not the concept now, because women are earning more and equal to men. So they are not bothered about the financial security. So what else they want? So this has become the biggest parameter of it. And diabetes, obesity, sleep apnea, hypertensions, all have been linked with erectile dysfunction or every sexual dysfunction. India is the diabetes capital of the world, closely losing to China. So I call China, Chindia are the diabetes capital of the world. And the commonest complication of diabetes is erectile dysfunction. So Chindia are the erectile dysfunction capital of the world. So many cases we have today in our country. All diabetics have low testosterone. And the saddest saga is that today erectile dysfunction is seen in younger patients. And India is a population where youth is more. That's because of smoking, watching porn. When they watch porn, they watch before they had sex or before they got married. They get arousals or erections watching the aggression in the porn, which is fabricated, which is all bullshit. That's not reality. So they get erections when they watch porn and they masturbate. So they are having sex with the images and the videos which they have seen. And when they get married, the same scenario is not there in their bedroom. So they don't get aroused, don't get erections. So wives come and tell me, the doctor, he didn't do anything during my wedding night. They don't do anything during my honeymoon period. I don't think so. He's a man. And that's one of the reasons why there were divorces immediately after marriages. Erectile dysfunction is inability to attain and sustain erection for a satisfying sexual intercourse. It should be there for 6 months, and there has to be an interpersonal distress. And this patient should not be on any drugs or having any mental disorder. Then only you can label him as erectile dysfunction. The main thing what happens in erection is there is a neurologically mediated increased arterial inflow in the spongy tubes of the penis. That's the first thing that happens. Second, there is a relaxation of the smooth muscles, so the blood remains there. And then there is a obstruction of the venous outflow, so the penis remains hard. Anything going wrong in these 3 processes results in erectile dysfunction. Many causes. But what I say, and my teacher tells me, that if nerves of the penis stimulate, if the vessels circulate, if these muscles facilitate it, hormones regulate, he is fine. This is a beautiful diagram to explain everything about erectile dysfunction. The upper thing which you see is the endothelial lining, where L-arginine helps from a normal endothelial cell to produce endothelial nitric oxide synthetase, which enters into, which potentiates the nitric oxide. Friends, nitric oxide is the main chemical signaling molecule, miracle molecule, currency of the cell, which enters into the corpora cavernosa smooth muscle cell, converts guanosine triphosphate to cyclic GMP. This cyclic GMP relaxes the smooth muscles and allows the blood to flow in. But sadly, this cyclic GMP hydrolyzes into 5-GMP with the help of an enzyme called phosphodiesterase 5. When you look at this, today what we have in our armamentarium to treat patients, we have PDE5 inhibitors in the form of sildenafil, tadalafil, sildenafil, vardenafil, and new kid in the block is avanafil. But to reach this stage, you need to have enough nitric oxide. And to have enough nitric oxide, you need to have a normal endothelium. Hence, erectile dysfunction is nothing else but endothelial dysfunctions. What is premature ejaculation? According to DSM-5, I don't call it as a disease, it's a psycho-behavioral problem. Every man suffers from this sometime or the other in their life. It's more common than common cold. There are no investigations, it's a psycho-behavioral fear, anxiety, guilt, frustration, low esteem, can be treated with non-pharmacological methods, drugs. Depoxetin 30 mg or 60 mg is the drug of choice. But you have to take it only once a day without alcohol. Other drugs are clonil, clofranil, paroxetine and tramadol. It's not, we can teach certain exercises and treat this without medications also. When it comes to women in India, they are all tight-lipped. They don't talk about it. Issues with them are less desire, less lubrication, less or absent orgasm, painful sex, vulvovaginitis, candidal infection, and depression is the most common feature of all women who have these issues. Couples therapy help. Lot of drugs which are available today, estrogen, testosterone, tibolone, herbal agents, flibanserin, a new drug, PD5 inhibitors also are given, testosterone or bupropion is the best drug for women who have depression due to these issues. So this sexual dysfunction is a problem to the individual and to the partner, and there is definitely a dent in their relationships. Should we be worried about erectile dysfunction? Why should we be worried about? Abhi 60, 70, why I want to have, okay, theek hai, chalta hai. That's the attitude. No, but remember, erectile dysfunction is the disaster, is an impending disease. These four patients all have erectile dysfunction: diabetic, hypertensive, obese, dyslipidemic. Erectile dysfunction affects 50% of male population above the age of 40. When I googled, I found Viagra had 196 million web pages and aspirin had only 53 million web pages. 80 to 85% men struggle in silence. Montessori beautifully explained why we should not ignore erectile dysfunction. The penile artery diameter is 1 to 2 millimeters, coronary artery diameter is 3 to 4 millimeters, internal carotid 5 to 7, and femoral artery 6 to 8. When atherosclerosis sets in, if the 50% penile artery gets blocked, it produces the symptom of erectile dysfunction. But the same amount of atherosclerosis does not occlude 50% of coronary artery, so it does not give symptoms of coronary artery blockage, which includes stable, unstable angina, acute infarction or stroke or claudications. But atherosclerosis is progressive. Sooner or later, the coronary arteries will also get 50% block and he will get those symptoms. And so, when penile artery gets blocked to 50%, that's the time when he gets this symptom. So, in fact, the erectile dysfunction is nothing but subclinical cardiovascular disease or coronary artery disease. Kumar Bhatia Kapoor, they studied and they found that onset of erectile dysfunction preceded the symptoms of coronary artery disease by a mean of 2.5 to 3 years, which means if a man develops erectile dysfunction, the next 3 to 5 years, he is likely to get coronary artery disease. So if you ask your patients who have a family history of metabolic syndrome, that do you have problems in making love? And if he says, you can change his lifestyle, you can correct his disorders and retard the onset of critical events like myocardial infarction or strokes and such. So penile attack almost equates heart attack. Hence, it's very important for you to ask this history. How do we treat erectile dysfunctions? We have drugs, first-line counseling, lifestyle measures, injections of papaverine in the intracavernous tissue, vacuum therapy, intraurethral prostaglandins. If these fail, we send our patients for implant surgery. But counseling and lifestyle measures are the backbone of the treatment. If you don't do that, nothing works. We have 4 PD5 inhibitors with various onset of action and duration of action. They all have side effects of headache, nasal congestion, despair, visual disturbances, and the contraindications, please remember, are nitrates. Don't give to PD5 inhibitors to any patients who are on nitrates. What's new? We have a beautiful drug called Avanafil, available in the doses of 100 milligram and 200 milligram. The beauty of this drug is that the action is within 15 minutes. It has got the least side effects, and the half-life is 5 hours. This is the only PD5 inhibitor which you can give to your patients who are on nitrates. Skip the nitrate on the day when he wants to take Avanafil and have sex. He takes Avanafil, he has good enough sex, this drug washes out from his body in 5 hours, and next day again he can start his nitrates again. So this is the only drug which you can give it to your patients. 50% patients don't respond to PD5 inhibitors. Melatonin is less in our patients who have erectile dysfunction and they have insomnia. So you can give them 3 milligrams of melatonin. It will also maintain its circadian rhythm. He'll get good sleep and he will also get good erections. We did a beautiful study of applying 0.2% glyceryl trinitrate gel on the glans penis. And these patients got fantastic erections. Only side effect was little headache. Bariatric surgery, insulin pumps. We've been treating ED for donkey's years, but we have not been correcting the pathophysiology of erections, which is endothelial dysfunctions. Herbs, etc. are fantastic. Today we have Shilajit, Ashwagandha, so musli, fenugreek, L-arginine, so many things we have available to us which you can. L-arginine has been studied, fenugreek has been studied beautifully and produces fenugreek. How it helps is it reduces hyperglycemia and it has got a chemical composition exactly like testosterone. So it displaces the globulin bound testosterone and makes the free testosterone more available. It increases the desire. L-arginine is nothing but nitric oxide donor which you require to initiate the whole erectogenic process. My take home message is, root cause or risk factor of all risk factor is endothelial dysfunction. So we must have strategies. My late teacher, Dr. R.D. Lele, showed so many successful strategies to reverse the endothelial dysfunctions. It's nitric oxide you need to take care of. Nitric oxide is the holy grail of inflammation. It's a miracle molecule, signaling molecule. How do you get nitric oxide? Nitric oxide is also required for the gaseous exchange which happens in the alveoli. It's associated with atherosclerosis. So don't put your patients only on PD5 inhibitors. They need nitric oxide. Discoverer of nitric oxide got Nobel Prize, Farid Murad. I met him in a cardiology conference, discussed a lot with him. There are 250,000 papers on nitric oxide. How do you get nitric oxide? First is from the endothelium. Second is we have got nitrate-rich diet, which includes beetroot, green leafy vegetable, nuts, pomegranate, watermelon, citrus food, etc. Nitrate-rich foods, when you take from the saliva, they are converted into nitrite. And when they ingest, when they go in the stomach, they are converted into nitric oxide. So you have a dietary source also to get nitric oxide. Lots of medications available to restore the endothelial functions and protect that against the diseases. As we age, all of us sitting here are all in a pro-inflammatory status. Anything which going wrong in our lifestyle will make our cells become senescence and we will get these dysfunctions. So aging is inevitable. We are all chronologically going to age. But we should understand, we should reverse the biological age of ours, which is the age of our cell. We should improve the clutter from the cell, make our cells rejuvenated every time. If you restrict calories, this is a beautiful, this is the take-home message. Friends, please listen to this and put it in your mind. If you restrict calories, you improve your mitochondria, increase the NAD, and increase sirtuins. Sirtuins are nothing but anti-aging proteins and genes which are present in the corpora cavernosa. Sirtuin 6 is present in excess, and if sirtuin 6 gets activated, you have lifespan and health span. Lots of studies to prove this. Okay. The second concept is autophagy. We have an innate capacity in our body to clean all the dirt in our body, which is there in cells through lysosomes, phagosomes, etc. And the discoverer of autophagy got a Nobel Prize. Hormesis, stress your body a little bit. If you're taking bath with hot water, take little more hot water and then take a chilled water bath. Do this. You will strain your body a little bit, but you will get adapted to it. What doesn't kill you makes you strong. Exercise is a hormetin of health. Even sexual, you have to have variety. See, sex is the same, penis going into the vagina, but initiate in a different manner. So that's also. So these three pathways are very much important, which is, you don't have to take any medicines for that. All you got to do is restrict calories. Restrict calories, that's it. If you look at the hallmarks of aging, one of the hallmarks is telomere. Now, telomeres are the ends of our genes. If you take a shoelace, the top of the shoelace is something like a telomere. Okay. Now, telomere length decreases as we age when the cells divide. Okay. And that's the aging process. So, telomeres shorten with the age, and these are leading to senescence and apoptosis. Shorter telomeres have also been implicated in genomic instability and oncogenesis. Older with shorter telomeres have 3 and 8 times increased risk to die from heart, infectious diseases respectively. So today, if you increase the length which is possible, okay, and studies have shown that individuals with erectile dysfunction exhibited shorter lymphocytic telomere length. And we have the capacities to increase the telomere length by calorie restrictions and workouts. 17 years of treating ED, we have not been able to correct the causes of it. So, my friend Dr. Paresh Dandona treated these patients with testosterone, all diabetics. They improved in their insulin resistance, sexual performance, etc. Dean Ornish, very famous name, with intensive lifestyle, he changed the coronary artery disease completely to the tune even of 98%. Studies have shown that. With intensive lifestyle changes, no statins, no surgeries, no stents, nothing. Cleveland Clinic, their original research says that nutritional intervention in their study halted and even reversed the coronary artery disease. See, coronary arteries are larger than the penile arteries. If nutrition can clear the coronary arteries, your penile arteries are always clean. So, that is possible only with nutrition. You don't need any medications. So the doctor of the future will no longer treat human frame with drugs, but rather cure and prevent disease with nutrition. Thomas Edison said this 100 and more years. So my forgotten perspective is, love your body. You all are unique. Everybody is unique and different. Avoid salt, oil and sugars. Have a Mediterranean. Why salt, oil and sugars? If you take excess of salt, you're prone to getting hypertension, you need medicines for lifetime, cause sexual dysfunction, and it's a killer. Oil ज़्यादा लोगे तो dyslipidemia, medicines for lifetime, sexual dysfunction, and it's a killer. And last is diabetes. We all know about it. Have a regular rhythm of sex life. Give a U-turn to your metabolic imbalance. Increase your romance. Increase your touch. Romance doesn't cost any GST. There is no income tax. Why can't you be romantic? It's very important. Every woman likes to be touched and have romance. Hugging. My teacher told me, how can I hug my wife in front of my daughter who's 25 years old? What will she think about me? I told him, sir, what will she think about you? She will only think that you still love your wife still so much. And don't you want this signal to go in her? Nothing wrong. Increase your romance. Rishi Vatsayana says, Sama Bhog means equal joy. Men have problems, women have less problems. So take your treatment, correct yourself, improve your lifestyle. What women should do, उनका भी कोई role है. They should regard their partner as a hero. येड़ा है, तेड़ा है, लेकिन मेरा है. Never give him any pressures to perform. These women all were abandoned by their husbands and they got a makeover done and they were again admired. So all the ladies present here, spend your husband's money as much as you can. Go to the nice parlor, look beautiful, look sexy, wear something which is, don't think about ये मैं आज नहीं कल पहनूँ, रोज पहनो, नया नया चीज रोज पहनो, nothing wrong in that. And make your husbands jealous of you. What men should do? Listen to her. When you come back from work, listen. Don't look at your mobile, don't look at TV, don't look at your laptop. Just listen to her when she's telling you what happened during the day. Don't give him answers, don't give him replies, don't give her anything. Just listen to her. If you give her this, oh, you should have called me. You are a big banana, wo ho gaya sab. She wants to tell you. Please listen to her. You know, you have to give half an hour in a day to just listen what she wants to tell you what happened during the day. So the onus of sexual health of your patients and yourself is with you yourself. Have realistic expectations. Sex at 80, 70 cannot be as what you had 20 or 30. Accept and adapt. Wrinkles don't hurt. You may be Hindu, Muslim, Sikh. Make lifestyle as your first and the most important wanted religion for lifetime. This is a beautiful slide. Please, you can take pictures. All red colored fruits, all green vegetables, beans, berries, avocados, mushrooms, seeds, flax seeds, chia seeds, pumpkin seeds, saffron, garlic, onion, ginger, almonds, walnuts, honey, dark chocolates, cow's ghee, milk, vanilla, white of the boiled egg. Avoid salt, oil and sugars. Sleep for 7 to 8 hours. Fasting 12 to 16 hours and walk for 30 minutes a day. Doesn't cost anything. Not even 1 rupee for your medications, etc. How much money you spend on Ozempic and all those drugs, etc. If you improve your lifestyle, your pro-inflammatory milieu will improve, insulin resistance will improve, endothelial dysfunction will improve, oxidative stress will reduce, and you have improved well-being and reduced burden of sexual dysfunctions. Medicine is not healthcare. Food is healthcare. Medicine is sick care. It's a time we realize this today. 2 times Nobel Prize winner. Who gets Nobel Prize? Friends, understand Nobel Prize is the biggest prize which any man can get, any scientist can get. A person who got 2 Nobel Prize, when he received the second Nobel Prize, he told to the world that every disease can be traced to a nutritional deficiencies. What else you want? So your health will depend on what you put in your body and what you do with your body. 2 minutes only. These are all 4 PD5 inhibitors. They don't increase the desire. 40% patients don't respond to it. Then we give them testosterone. But we can't give it to younger patients and older patients because of these issues. So who's the Raja of all? Arginine, fenugreek, regenerative medicine, and activate serotonins, autophagy, and hormesis. Friends, there is no law which says you must age. Build muscle. Muscle is anti-inflammatory. Take home this. Make muscle. Muscle is anti-inflammatory and fat is inflammatory. So choose what you want. Our body has a capacity to stop senescence, the aging of cells. Love and intimacy needs no medicines. A woman is a miracle. She is the best piece God has ever made. She cannot be compared to all. Feminism needs to be adored, admired, trusted, and respected. Look what Ramayana, look what Mahabharata told us. If a man who doesn't respect a woman from whom we have been here, we have been enjoying our life, we have been getting all the happiness, if a man who doesn't respect, admire, trust or feminism, I pray to God that he should get permanent, incurable erectile dysfunction. So it's a blessing today that if you have erectile dysfunction, it's a correctile dysfunction with whatever we have today. If you have patients who have ED, treat them. You can treat them. What's the big thing? Investigate them. Give them whatever I have told you. If you can't, send them to a good sexologist. He will see that he gets a good erection. Be fearless, focused, even in the bedroom. Elections can be faulty, but erections shall never be. This is my book, Sex Has No Expiry Date. My last slide. Today we have a sexual health tsunami across the globe. ED is prevalent and the earliest marker of coronary artery disease. These 4 PD5 inhibitors are effective treatments. Low-dose PD5 inhibitors, statins, can be the ideal choice for diabetics. Testosterone short course can be given with caution. L-arginine supplement and fenugreek is a boon. Diabetes remission is a fact and not a myth. Detailed history, counseling, empathy, education are the key. If you do so, friends, erectile dysfunction is a correctile dysfunction. All burning issues of sexual health can be extinguished, and sex has really no expiry date. Thank you all for your love. I'll be happy to answer any questions you all have.
Thank you very much, Dr. Jumani. I have heard you before also. You become more and more interesting every day as you grow. I don't see you growing older because you are
My
same.
age?
What I saw you few
I am
years
68
ago.
years old.
But anyway, the time is very short, so I'll just finish as a chairperson with my final comments. That is number 1. He stressed on PDE15 inhibitor that is called all tadalafil and sildenafil and now whatever fil. One thing, you are all doctors sitting here, one thing you must tell the patient when you are prescribing those pills, that just don't get yourself ready and your wife is not ready. Because if the bull is ready and the cow is grazing somewhere, there is no, you cannot have any effect of these things. Rather, you will have the bad effect. And at the age of 40 plus, mostly women play with their, आज हमारे सर में दर्द है, आज बच्चा नाती खिला रहे हैं, पोता खिला रहे हैं. अब ऐसी स्थिति में टैडालाफिल खा के सांड की तरह आप घूम रहे हैं, लुंगी पहन के, तो कोई फायदा नहीं. रादर व्हाट विल हैपन इज, आपके सामने हरे हरे नजर आने लगेंगे, फ्लशिंग ऑफ द फेस हो जाएगा, फ्लशिंग ऑफ द ये हो जाएगा, कलेजा धड़ धड़ करने लगेगा. इसीलिए पहले पत्नी से सलाह कर लीजिए. और उन्होंने जुमानी साहब ने जो अंत में कहा, पत्नी जरा बढ़िया से तैयार उयार हो जाए, आप भी तैयारी के, कहा कि सेक्स आफ्टर द एज ऑफ 40, 45, 50 थोड़ी तैयारी करनी पड़ती है. वो 20-30, अब 20-30 वालों को कहिए कि भैया तू लोग टाडालाफिल वगैरह मत खाओ. खैर, I have got my own because I am also a urologist sitting here, this gentleman, and we together started men's health clinic under the aegis of Urology Society of India all over the country. He started in Delhi. I am running one men's health clinic in Patna. And now being the Vice Chancellor of the university, Punjab University, he has gone one step further. He has got 3 courses in sexual medicine there in Punjab. Punjab needs it all, I don't know. 6 weeks course, which is a short course, a refresher. 1 year of fellowship after certain degree and all. And 2 years of degree. That he has already started there. those who are interested, they can contact Rajiv Sood and sort of go and do that course, and you can do it better. Every clinic, I tell you, no matter how busy you are, if you are dealing with men's health, then you have certain times, 2 hours, 1 hour, a separate time for men's health. And then only you can get the desired results. That is my submission. Thank you very much. I think we stop
One
here.
last thing I would like to say. Thank you, sir. Sex is not a secret. Who doesn't know? Even kids know about it. Please remember, sex is sacred. So after the age of 40, 50, make it as a worship. Don't make it as a crime कि जल्दी जल्दी करना है कोई देख लेगा. No, make it as a priority. Make it as a worship. We are all born out of it. It's a normal and natural function of our life. So respect that. Please, studies have shown that if you are able to have sex, there is no fear of myocardial
Jumani,
infarction. No.
Jumani, as the chairman of this session, I have the authority to stop here. Thank you very much.
I'd like to add only one thing.
Thank you, Dr. Jumani, for a very illustrious and enlightening and full of questions and queries. And the chairpersons, I think this session has gone already 45 minutes. So I request all the chairpersons and the speaker to move to the felicitation desk and request Dr. Prakash Raj Chandani, Dr. D.R. Rai, and Dr. Kumar Gandhi to help out in these ceremonies. Thank you, sir. Now I will call upon the coordinator for the next session, Dr. Nishesh Jain, to continue further.